The World Diabetes Day was commemorated under the theme Diabetes Across Life Stages.
Through the primary healthcare directorate in the Ministry of Health, and the ministry itself has availed prevention, early diagnosis, treatment, and follow-up care within the point of our first contact being the clinic. And also the health centers, district hospitals, and referral hospitals. This does not exclude also our community outreach and the recent unit called Health Post that the ministry established so that this care is available at the lowest point of care, which is at the village levels, as an example.
Ministry of Health and Social Services Deputy Executive Director Taimi Iyambo states that diabetes care is not a one-size-fits-all, rather it requires tailored approaches to address the unique needs of individuals from childhood through adulthood and old age. Iyambo has called on individuals, families, communities, employers, development partners, and government to work together to review the urgency of preventing diabetes.
The implication for diabetes can be a lot and more really life-threatening. I do know many of us here, we do know of people, whether it's in our communities, whether within our families, who are living with diabetes. Just raise your hand if you know of anyone living with diabetes. I do. Yeah, I do. So many of us, we do know, and we do take care and support people living with diabetes. And that is what we need to do as a country.
The World Health Organization country representative Dr. Richard Banda notes that in 2021, globally, over 537 million adults were living with diabetes, which is 1 in 10 people having diabetes, and in Africa, 24 million people were living with diabetes, and this is projected to double to 55 million by 2045. He says the prevalence of diabetes globally and in Africa is worrisome, and the high burden of the disease demands urgent, sustained action. Thus, World Diabetes Day raises awareness of the growing impact of diabetes and discusses strategies for prevention and management.
I know that diabetes is a significant public health challenge here in Namibia, with at least 6% of women and 7% of men living with this disease. This trend, if not reversed, will overwhelm our health systems, strain the economy, undermine the significant development achievements that we have already